This presentation is going to be on coronary heart disease. Coronary heart disease is located in the coronary artery, and what happens is fat deposits in the artery, which blocks necessary blood flow. So, coronary heart disease is hereditary. There is a higher chance that you will get it if it runs in the family. So, genetic factors such as heart attacks, strokes, and heart failure definitely play a role in the probability that you will also get heart disease. But that isn't the only thing. There are also risk factors such as diabetes, high blood pressure, high cholesterol, and congenital heart defects. And those are just things that are abnormal with the heart that develops before birth. So anything like leaky valves, holes in the heart, or defective vessels. And actually, I was born blue, and I had to have 2 blood transfusions due to the lack of blood flow through my body. And blue tinted skin during birth is actually an example of a congenital heart defect. So, since coronary heart disease is the leading cause of death, you do not have to tell me twice to stay away from these risk behaviors. And risk behaviors are just anything that we do consciously or non consciously that have an unknown outcome. So, some risk behaviors of coronary heart disease are physical inactivity, smoking, age, obesity, and high stress. And with age, actually, as you get older, you become more at risk for getting heart disease. And also, when you smoke, you are 2 times more likely to get heart disease as well. And with obesity, too much body fat puts a lot of stress on the circulatory system, so that's why it's also a risk factor. So, we're not all doomed because our great 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 grandpa also had heart disease. There's also prevention for coronary heart disease. And one is eating foods low in fat. Another is exercising regularly, avoiding becoming overweight, and also watching your cholesterol. Cholesterol is good for you, but too much can clog your arteries. If you avoid becoming overweight, it will put less stress on your circulatory system. And eating foods low in fat like rice, bread, and oats will also keep your heart healthy, which is key to preventing heart disease. So, just like you can prevent heart disease, you can also get it treated. The most popular is cardiac rehabilitation, which helps people adopt heart healthy lifestyles, education about heart healthy lifestyles, and also a goal of widening clogged arteries. On average, it's about 36 sessions for 12 weeks. There are also surgical procedures that people can undergo in order to help treat coronary heart disease. One is an angioplasty, and that is where a surgeon opens up a blocked artery to restore normal blood flow. And there is also the artery bypass grafting, which connects a healthy artery to a blocked artery so it can bypass or go around the blocked portion of the coronary artery. And what this does is that it creates a new path to oxygen-rich blood flow. So from my personal experience, I had a friend in 2nd grade named Morgan Booker, and she had this arm cast on her arm, and one day I asked her, "What happened to your arm?" And she said that she had a stroke. So being in 2nd grade, I had absolutely no idea what that meant, but now I know that a stroke is a loss of consciousness due to a disruption of blood flow to the brain, and it's actually the 3rd leading cause of death after cancer and coronary heart disease. And 600,000 strokes happen in the US every year. It's crazy. And Morgan is probably the most optimistic person that I know. And so it's just amazing to see how strong she is. And I will always be inspired by her. Thanks for listening.